Next, we're going to hear from Dean Ornish, who many of you have known and heard of him, read his books. He's a very big best-selling author for many years. He's the one that convinced Bill Clinton to become a vegan. He was a big health advisor to Steve Jobs. He's known for a lifestyle-based approach to fighting heart disease and generally maintaining health. He's got a lot to say, which I really love to hear. And he's also doing a workshop tomorrow morning at 7:15 in those breakout rooms over there. But rather than go too much further down that path, I'll let him explain it. So Dean, come on up.
Thanks.
So good to have you at Techonomy.
Great to see you.
Thank you.
Thank you.
Yeah. Thanks.
So thank you, David and Simone, for the chance to be here. I'm really grateful. I want to talk about a new field of what's called lifestyle medicine, which is using lifestyle to not only help prevent disease, which we all know, but actually to treat it and even often reverse it. And for the last 40 years, I've directed a series of studies showing that these simple changes in lifestyle, a whole foods plant-based diet that's naturally low in fat and refined carbs, various stress management techniques, including yoga and meditation, moderate exercise, and what may be the most important of all of them, what we call psychosocial support or love and intimacy, or to reduce it down still further, to eat well, move more, stress less, and love more. That's really it. We've used these very high-tech, expensive, state-of-the-art scientific measures to prove how powerful these very simple and low-tech and low-cost interventions can be. And after doing this work for 40 years, I think it's finally the right idea at the right time. There's a convergence of forces. For the one thing, the limitations of drugs and surgery have become increasingly well documented. Just a couple days ago, you probably saw this study that came out showing that stents and angioplasties don't reduce angina any more than sham procedures where they just pretended to do that. It had already been shown in 8 randomized trials that stents and angioplasties in stable patients don't prolong life, don't prevent heart attacks. And yet we spent like $50 billion last year on this one intervention that's dangerous, invasive, expensive, and largely ineffective. In the case of men with prostate cancer, there was a major study that came out in the New England Journal 1 year ago, where they looked at men who had early stage prostate cancer, and after 10 years they found that those in a randomized trial, those who did nothing lived as long as those who had surgery or radiation, and yet the surgery and radiation maimed guys in the most personal ways, so they're either impotent or incontinent, often impotent or incontinent or both, without any real benefit at huge economic and personal cost. And in the case of type 2 diabetes, which is epidemic, half of the American population today is diabetic or pre-diabetic, and yet the studies show that getting your blood sugar down with drugs doesn't prevent the horrible complications of diabetes, the amputations and blindness and impotence and kidney failure and heart attacks and strokes. Getting your blood sugar down with drugs doesn't help prevent them nearly as well as getting it down simply with diet and lifestyle. And so there is a convergence of forces that finally make this the right idea at the right time. And so we've been, I thought that if we just did good science, that would change medical practice. And so through our nonprofit institute, we began training hospitals and clinics around the country. We got bigger changes in lifestyle, better clinical outcomes, bigger cost savings, and better adherence than had ever been shown. And yet a number of the sites closed down because we didn't have the reimbursement. So that set me on a 16-year journey to see if we could get Medicare to cover our program. And we had the support of Bill Clinton when he was president, and he's been on my program now for many years, and especially since his bypasses clogged up 8 years ago. And Newt Gingrich when he was Speaker of the House, and 20 members of the Senate, 30 members of the House, across the political spectrum. It still took 16 years, although when I talk to people in government, they say only 16 years, so I guess it's all relative. But now when you change reimbursement, it changes medical practice and even medical education. And that's what we're finding. We're really creating a whole new paradigm of healthcare rather than just sick care. And so we've been training hospitals and clinics and physician groups around the country and health systems. And again, we're showing bigger changes in lifestyle, better clinical outcomes, bigger cost savings, and better adherence. It's working. And we're showing, for example, Mutual of Omaha did a study where they found that they could cut, that 80% of people who were told they needed a bypass or a stent were able to safely avoid it by changing their lifestyle, and they saved almost $30,000 per patient. And Highmark Blue Cross Blue Shield found they cut their costs in half in the first year. And when they looked at the high-cost people that they spent at least $25,000 on in the previous year, they cut their costs by 400% in that following year. So if you're dealing with it turns out that 5% of people in this country account for 80% of the healthcare costs. And those are the people that we work with. And then you can show cost savings are dramatic and immediate. And also because these underlying biological mechanisms, the more diseases we study and the more underlying biological mechanisms we do research on, the more reasons we have to explain why these simple lifestyle changes are so powerful and how quickly they can occur. We started with heart disease. We found we could reverse that for the first time. We then found that men with early stage prostate cancer who made these same changes could slow, stop, and reverse the progression of their disease. If it's true for prostate cancer, it'll almost certainly be true for breast cancer. High blood pressure, high cholesterol, obesity. You know, when people get put on these drugs to lower their cholesterol or blood pressure or blood sugar, say, doctor, how long do I have to take these? The doctor usually says, forever. And the real underlying guiding principle of all of our work is to treat the cause. Sometimes when I lecture, I'll show a cartoon of doctors busily mopping up the floor around a sink that's overflowing, but nobody's turning off the faucet. And what we're finding is that if you treat the cause, which to a larger degree than we had once realized, are these lifestyle choices that we make each day, that our bodies often have a remarkable capacity to begin healing, and much more quickly than we had once realized. And we can measure that. We find, for example, that when you change your lifestyle, it changes your genes. Over 500 genes in just 3 months in a study we did with Craig Venter, who decoded the human genome, turning on your good genes, turning off or downregulating the genes that cause prostate, breast, colon cancer, heart disease, diabetes, and so on. It's just amazing how dynamic these mechanisms are. And we did a study with Elizabeth Blackburn, who got the Nobel Prize for her pioneering work with telomeres, the ends of our chromosomes that regulate cellular aging. And we found that we could begin to reverse aging at a cellular level by lengthening telomeres. It's really the only control study that's shown that any intervention, including pharma, can do that. And we're downregulating angiogenesis in men with prostate cancer. So the more diseases we study and the more biological mechanisms that we look at, the more reasons we have to explain why these simple changes are so powerful. And because these mechanisms are so dynamic, it really reframes the whole reason for making these changes from fear of dying, which is not sustainable, to joy of living, which is. When you make these changes, you feel so much better so quickly. I mean, people have angina or from heart disease who can't walk across the street without getting pain. They can't work. They can't make love with their spouse. They can't play with their kids. They can't do any of the things that make life fun. And within a few weeks, they generally become pain-free. So the choices become clear, and it reframes it from a living longer to living better. And that's ultimately what makes it sustainable. And one of the things that David and I talked about when we had a dialogue in New York at the Techonomy Conference last year, or earlier this year, was that, to me, one of the fundamental causes of illness that I'm so struck by is the breakdown of the social networks that used to give people a sense of connection and community. And study after study are showing that people who are lonely and depressed and isolated are 3 to 10 times more likely to get sick and die prematurely from virtually all causes compared to those who have a sense of love and connection and community. So in our program, we use, once they've bonded with each other in support groups where they can really be open and authentic with each other, after Medicare pays for 72 hours of training, then they continue to meet virtually using Zoom and other video technologies. And we find that works just as well as being there in person, sometimes even better because you don't have to get in a car and go anywhere. And so people show up. They just say from 4 to 5 on Thursdays or whenever, we're all going to connect together, a group of 15 people, and they can really support each other in ways that are incredibly meaningful. You know, the real epidemic isn't just heart disease or diabetes or whatever. It's loneliness and depression and isolation. 50 years ago, most people had a neighborhood with 2 or 3 generations of people living together. They had an extended family they saw regularly. They had a job that felt secure. They had a church or synagogue they went to regularly. Many people don't have any of those things. And I think one of the reasons why Facebook has, you know, over 1 billion members is because there's a primal, profound need for connection and community. The problem with things like Facebook, though, is that it connects us in ways that can often isolate us. Because you know, if you grow up in a family, they know your dark side. They know your stuff. They don't just have your beautiful Facebook profile and your perfect life that you show on Facebook. They know your dark stuff. And there's something incredibly healing and powerful about knowing that somebody knows all of you, not just your bio sketch or your Facebook profile, but they really know you and they're still there for you. And so what I'd love to see is, and I think where the real opportunity is in whatever business people are doing, but especially the kinds of online communities that we're talking about, is a Facebook, an authentic Facebook, where people can let down their emotional defenses and just be authentic with each other and not just talk about all the wonderful things that they're doing and their perfect vacation and their perfect life, but where things are hard, where you're messing up. And there's an incredible, and that's why our support groups, which are the part of our program that people often have the most skepticism about, are ultimately the most meaningful. Because in business, when you can meet an unmet need, you can create a successful business. And if the unmet need is as primal as the need for intimacy and connection and love and authenticity and meaning, then I think we can, I mean, whoever comes up with this is going to make current Facebook look small by comparison. And so to the degree that technology can really be used to bring us together and not to isolate us, I think that's where the healing can come from. And healing really comes from the root to make whole. You know, yoga comes from the Sanskrit, to yoke, to unite, union. These are really old ideas that we're rediscovering. So this is what we'll be talking about tomorrow morning at 7:15, and if you can join us, I'd love to share that with you. Thank you.